Hello, this is Kang from Joseon College in Nursing. Let's start the presentation now. Our title is the effect of nursing students' blood transfusion nursing practice according to methods of utilizing educational media. The table of contents is as follows. First, introduction. Background. The nursing field is one of the rapidly changing areas of healthcare field, which is becoming increasingly specialized and complex. Accordingly, there is a demand for nurses who can perform high-level nursing from the moment they enter the workplace. Therefore, practical education to develop the ability to perform actual patient nursing is emphasized more and more in nursing education. Through clinical practice education, it is necessary to become acquainted with practical work in actual hospitals and to practice nursing for various patient cases. However, because the safety and rights of patients are more important than before, clinical practice education is now replaced by observation rather than direct practice. Therefore, there is need for a variety of safe and effective educational methods that can improve nursing students' practical nursing skills and experience field-oriented practical education. As interested in the possibility of using advanced technology increases, the use of virtual reality for practical education of nursing students is being proposed and an alternative. Since education using virtual reality is conducted without threatening patient safety in virtual reality, repeated training is more comfortable than practicing with real patients. This is repeated training enables students to provide safe patient care and as new nurses with skills in the field after graduation. Blood transfusion is one of the important actions in patient safety, and since the transfusion process is a complex process involving several steps and various medical personnel, students who have learned transfusion nursing must be trained to be familiar with the procedure as a habit. In order to strengthen the patient safety competency of nursing students who will be in charge of transfusion nursing as future nurses, it is necessary to provide simulation education that is safe and can be repeated if necessary. The application of a nursing education program that maximizes the advantages of virtual reality technology can expand students' learning opportunities and improve the overall quality of nursing in the future. In addition, if sufficient evidence for the practical effect is presented through a high-quality intervention study examining the effects of nursing education using virtual reality, it can be used as evidence to actively introduce virtual reality technology in the future. Second, research purpose. This study aims to investigate an effective practical education method by comparing the blood transfusion nursing practice education method applied with virtual reality and the blood transfusion nursing practice education method applying the traditional arm model. Compare the method applying the VR transfusion nursing education medium, the method applying the arm model, and the method applying the two in parallel, and evaluate the educational media with high knowledge, performance competence, blood transfusion nursing performance, and educational satisfaction among the three methods. Second method, research design, subject, tools, data collection, procedure, data analysis. First, research design. This study used a non-equivalent control group pre- and post-similar experiment design to compare the effect of transfusion nursing education according to the method of using educational media for nursing students at one university. Second, research subject. The subject of this study were 53 students enrolled in the third year of the Department of Nursing. Subjects were assigned to the control group for the first period, the second period for the experimental group 2, and the third period for the experimental group 1 by allowing the subject to directly select the period and when they can participate in the education through the recruitment notice. The final experimental group 1 had 18 students. The experimental group 2 had 17 students, and the control group had 18 students, which was the final 53 students, excluding subjects who were absent due to personal reasons and didn't participate in the follow-up survey. Research tool. Transfusion nursing performance ability. The transfusion nursing performance measurement tool evaluates the ability of care for patients before, during, and after blood transfusion. 3 types, including the latest textbook on Beijing nursing materials and skills, and clinical performance ability checklist revised and supplemented by Lee Sun-hee based on the transfusion therapy of the core Beijing nursing protocol was used. This tool consists of the total of 5 items, and each item was scored as completely performed 2, particularly performed 1, and not performed 0. The total score is up to 70, and the higher the score, and the higher blood transfusion nursing performance ability. Knowledge. 2 measures of knowledge necessary for clinical performance and clinical judgment required for transfusion nursing. The knowledge measurement tool developed by these researchers through expert content validation with 1 Beijing nursing professor and 2 other nursing professors based on the learning goals for transfusion nursing among the basic nursing learning goals is used. This tool is a self-filling method consisting of a total of 10 questions. Each question was given 5 answers. For each question answered, "I don't know" was inserted to control the guessing error. A correct answer to each question was scored as 1 point, as an incorrect answer and "don't know" were scored as 0 point. It ranged from 0 to 10, with a higher total score indicated a higher knowledge of transfusion nursing. Performance confidence. Performance confidence is a tool measuring the degree to which one believes that one can confidently perform transfusion nursing skills. It was developed by this researcher through expert content validity verification by 1 professor of Beijing nursing and 2 professors of adult nursing. The questionnaire consisted of 10 items, including preparation for transfusion, explanation of the purpose of transfusion, blood conformation, principle of administration, correct skills performance, and description of side effects and reporting when they occur. Each item is rated on numeric scale ranging from 0, not at all confident, to 10, very confident, with higher scores indicating higher confidence. Education satisfaction. For educational satisfaction, the two of Lee Sung-shim and Kwon Mi-kyung, which was the tool developed by Eun-kyung Lee, was modified and supplemented the tool of Park Jong-tae, which partially modified the flow stage scale FSS test tool used in the study of No Kyung-hee, was partially modified to fit the purpose of this study. The education satisfaction test consisted of 21 items in total and was measured on a 5-point Likert scale, ranging from 0 point of not at all to 5 points of strongly agree. Higher scores indicate higher educational satisfaction. Data collection method. This study was performed with data collected from February 18th to February 21st, 2021. The subjects were those who gave consent after the researcher explained the purpose and method of the study directly to the subject. It was explained that withdrawal is possible at any time if not desired, and that there will be no disadvantage, and that the data will be used for pure research purpose only, and that all personal matters are statistically processed anonymously and confidentiality is guaranteed. Participants were given a small gift in return. Research procedure. First day program is as follows. Blood transfusion nursing theory education at 30 minutes. And we gave blood transfusion nursing skills training for 30 minutes. And self-study in practice education media for each group. Experimental group 1 is VR and traditional arm model. Experimental group 2 is VR and control group are traditional arm model. They have 90 minutes. Second day, evaluation and post-training is 30 minutes. Data analysis. The data collected in this study were analyzed using the SPSS version 22 statistical program, and the analysis method is as follows. The general characteristics of the study subject were analyzed by frequency and percentage, mean and standard deviation. The prior homogeneity verification of the experimental group and the control group was analyzed by the chi-square test and cross-cut-Wallis according to the characteristics of the variables. The pre-homogeneity verification of the knowledge and performance confidence of the experimental group and the control group before education was analyzed by Crozer-Wallis. The comparison of difference in knowledge, performance confidence, performance ability, and educational satisfaction between the experimental group and the control group after education was analyzed by Crozer-Wallis. The reliability of the measurement tool was analyzed with converse alpha coefficients. Results. This is table for homogeneity tests for general characteristics between groups. The result of analyzing the homogeneity of the experiment group and the control group for general characteristics according to age, gender, academic achievement, major satisfaction, job hope, and personality, there was no significant difference between experimental group 1 and 2, the control group, and homogeneity was confirmed between the three groups. This table is homogeneity table for dependent variable. As a result of performing cross-call to analyze the differences in knowledge and performance confidence of the three groups, there was no significant difference, and the homogeneity of the three groups was confirmed. This table is comparison of knowledge, performance confidence, performance ability, and educational satisfaction among the three groups after education. Comparison of the dependent variables as education among the three groups. As a result of difference tests of the three groups after education, there were significant difference in performance confidence, performance ability, and learning immersion. Conclusions. This study different from the research method of previous study targeting nursing students. The educational effect of the simulation was evaluated by dividing into experimental group 1, which combined education using virtual reality and education using traditional arm model. Experimental group 2, which was educated using only virtual reality, and control group, which was educated only through traditional arm model. The education that applied virtual reality and arm model together improved the nursing performance ability of students, increased their performance confidence, and the state of immersion was measured high among the educational satisfaction. In particular, rather than using only VR simulation, it seems that the performance ability was improved by performing repetitive learning by performing the technique on the arm model again after VR training, and also the confidence and satisfaction level increased. Also, in order to help nursing students learn, it was a study that showed significant effects not only by using the traditional arm model, but also by applying various methods in parallel, such as applying virtual reality. It is expected that various teaching methods will be shared among instructors and that effective learning methods will be developed. Based on the result of this study, I would like to make the following suggestions. First, in future research, we suggested the study that expanded the scope of subjects, such as not only nursing students, but also healthcare works such as new clinical nurses. Second, research on the development and application of virtual reality programs that can improve students' nursing performance ability by combining virtual reality with various class contents and in addition to transfusion nursing is suggesting. Thank you.